another edition of Perspective. I have here today a great guest whom I have a lot of respect for. You've all asked for him. I've received tons of messages on my Instagram asking for this doctor back. I call him 10 doctors in one because he literally has more than 10 specialties. My superhero doctor, Dr. Jim Meehan. Welcome to Perspective.
Oh, it's so great to be here, Maryam. Thank you so much for having me back, and you do me great honor with your wonderful intro, but I'm not sure I deserve all that. I'm just a man doing the work I was called to do.
And you deserve more than that, Dr. Meehan. You're great, and I admire you for everything that you're doing. Before we start, you're welcome. Before we start, I would like to convey my condolences to the Iranian people for the loss of legendary Mr. Shajarian. And it was a great loss, Dr. Meehan. I don't know if you know about him, but he was a patriot.
I do. Yeah, I do. I mean, when I saw the news, I did a little bit of research, and my condolences to the people of Iran. To lose such a beautiful voice as you know, one of the 50 greatest voices in history is what I've read, and probably even higher in the accolades that I've seen. But when the world loses such a talent, it just becomes dimmed. And so my heartfelt condolences to the people of Iran.
Thank you so much. Thank you. Unfortunately, he was banned from singing, and full censorship on all of his work. So I'm sorry to hear that. But now, as we talk about censorship, let's go to the current situation and the concern about masks. Dr. Meehan, this is a huge issue right now, and there is a lot of infections going on. There is a lot of other problems that have been caused by these masks.
That's exactly right. I mean, you know, I've been so confounded by what I've been hearing from our public health experts since this pandemic, you know, began, and then especially when they kind of changed their tune mid stride in this pandemic, because in the early stages of the pandemic, it seemed like our public health experts were going with what the science, you know, 4 decades of science had always said, was that these, you know, the community wearing a mask, the public wearing a mask, has never been shown to be effective in mitigating the transmission of upper respiratory viruses. We've studied it in depth for 40 years, and the conclusions of the highest level science, and we're talking about meta-analysis of multiple randomized controlled trials, had always determined that masks do essentially nothing. They provide no benefits in the prevention of upper respiratory pathogens like influenza, and similar pathogens. SARS-CoV-2 is very similar to influenza in its transmissibility, its size, etc. So there's no reason to believe that SARS-CoV-2, the virus that causes COVID-19, would be any different than influenza. And yet, and so in, you know, February and March, Dr. Fauci, the CDC, the World Health Organization, Dr. Redfield, the director of the CDC, they were all saying, don't wear masks. They won't be effective in blocking coronavirus. And yet, about 30 days later, they started changing their recommendations and started saying, wear masks. They might help a little bit. They may, you know, provide some benefit. And that's when I got involved. That's when I started. I dug deeply into the science, and it's science that I was really familiar with because I am a surgeon. I've done over 10,000 surgical procedures. I've had to wear masks in all of those surgical procedures in a surgical suite. I felt the adverse effects of wearing a mask for long surgeries. A lot of people will be surprised to learn that surgeons have known for a long time that masks, the surgical masks that we wear, are do not prevent infections in patients. They don't block or prevent or change wound infections in surgeons doing surgery on patients. So that in many places in the world, we no longer wear masks during clean surgical procedures. Those surgical procedures that don't involve, bone saws or blood splatters, things that I hate to use those terms, but that's some of the power tools that are used in some surgical procedures will kind of release bodily fluids into the air. And so in those cases, non-clean surgeries, we would wear surgical masks to prevent those bodily fluids from getting in our mucosa. But in most clean surgeries, they're unnecessary, and they've been shown to be ineffective. One of the most trusted authorities on this topic is the Cochrane Collaboration. That's COCHRANE Collaboration. They're an independent body of physicians and scientists that do some of the highest level analysis of the medical literature. And in 2010 and again in 2014, they did an analysis looking at all of the randomized controlled trials that were available with regards to surgical masks in the operating suite, and concluded that they offered no benefit. And I mention all of that because one of the arguments that's often used to support masks is, well, surgeons wear them, so they must be effective. But that is a fallacious argument, and the science says they really aren't effective in preventing wound infections or protecting patients under surgery from getting infected by whatever bacteria may come from the surgical team. So we've known that for a long time. Masks really don't protect the surgical patient from surgeons. We still wear them many times, more out of tradition, and because many of the surgical hospitals will require them. Not everybody is up to date on the latest medical science, and often it's our hospitals that are about as far behind as you can possibly be. But that argument that they must work because surgeons wear them is a fallacious argument. It's not based on the latest science. And I can tell you, as a surgeon that wore one, that in long surgeries, most surgeons will change out their mask because we recognize what the science has shown, that, and what we have personally experienced, is that masks block oxygen. The longer you wear a mask, the more moisture it starts to retain, the more that oxygen diminishing effect in our bloodstream becomes physiologic, important. It starts causing tremors and brain fog, and just diminishes our fine motor skills. So we would often, after about 30 minutes of surgery, we would change our masks to a fresh mask so that it wouldn't have that negative impact of lowering our arterial oxygen. They also cause us to rebreathe our CO2, which also alters our physiology in a negative way. So I've experienced those. I always change my mask out, and that's in a surgical suite, by the way, that is, has high air exchange. It has slightly higher levels of oxygen in the air than in your typical environments, and it's also a cooler temperature. So surgeons wear masks in an optimal environment for wearing a mask where the adverse effects are minimized. And even in that environment, it has been shown to diminish our fine motor skills, to cause brain fog and even headaches. And that's been studied. It's well published. And one of the things I'd love to share with your viewers and listeners is a 50-page dissertation that I've put together beginning in about March on all of the science that covers these issues. And I'd like to make that available for you to share to any of the people that are interested in knowing what the real science says, because I'm very passionate about this issue. When I looked to see what possibly could have been new in the science, that Fauci and the CDC were starting to say in March, yeah, go start wearing masks. We need to flatten the curve, and masks could be a part of that. I was curious because I hadn't seen any new science. I had reviewed it all, and I started looking. There must be something new out there, some new study, some high-level evidence that would cause them to change the course of their recommendations. And I looked everywhere. I looked at everything. I read everything, and there was nothing new. So I really questioned the narrative. Why are we telling the community to wear masks? Because as soon as that started happening, all you had to do was go out and observe people that were untrained in sterile technique and how to properly manage your mask to see that we were creating a real problem, a problem that could probably increase the transmission of disease, a problem that could affect a large percentage of the population, Miriam, that already had medical conditions, that wearing a mask, with somebody who has COPD or asthma, chronic bronchitis, any respiratory condition, many psychiatric diseases that would get worse, PTSD, anxiety, conditions that would get worse if they started wearing a mask, lowering their oxygen, blocking their airways, increasing the pressures in the lungs, that all of these medical conditions could be made worse by wearing a mask, when we're just saying universally everybody's got to wear a mask. And nobody was considering the 7.5% of children in the United States that have asthma, or 7.5% of all people in the United States that have asthma. So who's taking care of them? Who's watching out for their health? It wasn't our public health experts that were saying everybody wear masks. It wasn't our politicians that were saying everybody wear masks or we're going to fine you, $1,000 or $10,000, or we're not going to let you come into the store to get the food. That is also very important to your health. So I was probably as confounded as anybody out there, and I'm sure you had your own questions about all this, didn't you?
Actually, I'm glad, first of all, that you mentioned about the surgical suites and the doctor's office, because a lot of people don't know that there are certain regulations and parameters for the doctor's offices. And as you mentioned about the oxygen exchange and the airflow and all that, and also wearing a mask, which everybody has one of these, and you as a surgeon, you know how to use this. But a lot of general public do not know when they use this and they just put it anywhere. This is going to be even worse than, I guess, wearing it, because a surgeon knows how to remove the mask and how to use it. But
absolutely. I mean, Maryam, surgeons, doctors, we undergo a lot of training, a lot of even hazing, if you will. If we don't handle our masks, there are nurses in that operating suite that, that if we handle our mask improperly, they will light us up. They will make sure that we use the proper techniques post haste. And because and the other thing is that when we wear masks in the hospital, the operating room, we are wearing that mask once and we're disposing of it. Sometimes after just 30 minutes or an hour of wear, we wear it once, we never reuse it. And what we were doing, these blanket recommendations by health authorities and politicians to wear masks, number one, if you're going to wear a mask properly, every member of your family is going to be shelling out about $40 a month to, use the mask once, replace it. And that's if you're just wearing it one mask per day. So it becomes an expensive process. Most people can't afford that in their budgets. So they were taking a single-use mask and they were wearing it, weeks at a time, if not months at a time. And if you observe the way the community were wearing these masks, you could see the stains on the mask, you could see the discoloration. They were clearly wearing a mask far too long. They weren't disposing of it properly. And let me tell you about some science that's been done on that type of mask wear. In Germany, they would give children they studied this issue in school-age children. They would give a school-age child a fresh mask. They would have them wear that mask for 6 hours during school. They would collect the mask and send those to the laboratory to culture the bacteria and other microbes that are growing on that mask after only 6 hours of wear. And what they found was 81 colonies of bacteria, 4 colonies of fungi,
it's a petri dish.
Multiple pathogens were growing on that mask after just 6 hours of wear. Some of those pathogens, excuse me, some of those pathogens were coming from just the oral bacteria that live in our mouths. Much of it was coming from the environment, so a child especially is at great risk when they're wearing a mask. They are they don't tolerate it well. They touch their face a lot. That mask is accumulating the bacteria from their environment, from their lungs, from their mouth, and that bacteria is growing on that mask. Now they touch it and they're transmitting it to the desk, to the pencils, to whatever it is that they touch, and it can literally increase the transmission of dangerous diseases. Now we're also seeing an explosion in bacterial pneumonias in our urgent cares and emergency rooms. These, and a bacterial pneumonia can be much more damaging than a viral pneumonia. It's usually a bacterial pneumonia that kills patients when they die of pneumonia. The viral pneumonia kind of sets up for the bacterial secondary infection to come in, and those bacterial infections are devastating to the human lungs. So we're seeing an explosion of that. And where's that coming from? Well, it's coming from this kind of situation where all of these bacteria are collecting, they're growing on the mask. Now our children are being forced, or all people are being forced to breathe in. Every inhalation can bring some of those bacterial particles, those viral particles, those fungi, and deep into the lungs. When we wear a mask and our oxygen is inhibited, CO2 rises. Those changes in our blood gases change our respirations. They make our respirations more frequent and deeper. So we're breathing more frequently and deeper, and with every inhalation, we have the potential to suck in, to inhale some of those pathogens that are on our mask right back into our lungs, deep into our lungs. Now, what's going to happen? I mean, science will eventually show that the wearing a mask by the community that is ill-equipped and untrained is going to increase disease in the population. I'm convinced of it. That's my prediction. I'd put my money on it. We're already seeing the early evidence that that's what's occurring. So I think that masks offer the science says masks provide no benefit, and we're going to discover that the science is going to confirm that masks cause imminent harm to their wearers.
And Dr. Meehan, another thing is that the psychological effect that is having, especially on the children, the fear and all the panic and the anxiety. And it seems like, it's a crime to see a little 4-year-old, 5-year-old, wearing a mask. And it seems like they are conditioning our children into being robots. Yes. And that's very unfortunate.
Yeah, the psychological impacts. I was actually testifying as an expert in a case in the state of Connecticut, and in which a group of parents were suing the State Department of Education on this issue of masks. And one of the other expert witnesses was a psychiatrist, and his points about the psychological and injuries to children when they are, unable to see the smiles of their friends, be able to hear their teachers properly, to have their oxygen inhibited and their anxiety increased. We are really doing some, not only physical damage to our children wearing masks, but we're doing psychological injury to our children. Many of our children have, sensory deficits. They don't hear as well, and they have to read the lips of their teachers. Many of these cases are undiagnosed out there. We also have a large percentage of children in the world today that have neurodevelopmental disorders or autism spectrum disorder, where even the touch of the mask is very uncomfortable to them, and that alone increases their anxiety. So we're putting children who have almost no risk from this virus. I mean, a child that gets infected with COVID-19, SARS-CoV-2, has about, their survival rate is 99.99815%. They have a 99.99815% chance of surviving that infection, which is a far better chance than influenza. SARS-CoV-2 in young people, young adults, and certainly children is much less dangerous than influenza. We've never masked the population for influenza, and we should not be masking the population for SARS-CoV-2. Children are at almost zero risk, and there are significant risks that the masks cause. So this is the imminent harm that really causes me to rise to speak and say, look, guys, here's the science. Here's what the science says. What are you doing? Where is your science? Because I've looked at it. And the best science that the pro-maskers and the politicians have are 29 observational studies. These are observational studies, are low-level evidence. Observational studies we can make lots of mistakes when we don't control for all the variables. When you have an observational studies that say, looks like when we put masks on in this, this state or this country, that cases went down. Well, the cases were going down already. So when we say that, okay, this is a sampling error, the disease course is already tracking down. You mandated masks really late in the game when everything was falling already, and you want to take credit for the natural course of infectious respiratory viruses by saying it was the mask that caused that. Well, that's not really science. That's association science. That's low-level evidence of science. So there's the World Health Organization commissioned a study to look and create a meta-analysis, which is typically considered high-level science, right? A meta-analysis, usually of multiple randomized controlled trials. But what they did, they were just dressing up 29 observational studies, retrospective observational, low-level science, and they were calling it a meta-analysis. And in this paper that I'll share with you, I will debunk those studies. I'll show you how they made so many errors. Most of those studies involved healthcare workers, which is not the community. Only 4 of those studies involved the community, and almost every one of the 4 studies involving the community showed no benefit to masks. That's what they threw out there as scientific support for masking the population. And that was a garbage in, garbage out study. You study garbage, you can sift through it all you want, and all you're going to get, no matter how you dress it up and call it a meta-analysis or otherwise, is still garbage data. It's not much that we can do with. Now, the largest analysis of the data of mask mandates and lockdowns and the infectious disease curve was conducted by the National Bureau of Economic Research. They looked at 25 states and 23 countries. Big data, massive amounts of data from multiple databases in these areas where there were more than 1,000 cases in the region. And what they found was, no matter what humans did, lockdowns, masks made zero difference. In fact, when you look at these big data and you look at the disease courses and when the mask mandates came in, what you actually see is a slight uptick in deaths and hospitalizations that follow the mask mandate by about a week to 2 weeks. So I'm going to firmly say that my hypothesis based on the data is that masks cause harm. They are likely to increase the disease, and especially when we have a virus like SARS-CoV-2, Maryam, this virus is going to transmit like all viruses do throughout the population. There's not much that humans can do. But if you get SARS-CoV-2 and it's now replicating in your cells and your immune system, even a strong immune system, is starting to eradicate that. But now, instead of breathing out those viral particles of SARS-CoV-2, because when they invade our cells, they replicate in our cells, then they burst the cell, they kind of kill the cell, and they release themselves back into the airway. Normally, our lungs in the normal respiratory process would breathe out those virus particles. They would fall, neutralize on the ground within about 6 feet. But when you put a mask on your face while your lungs are infected with SARS-CoV-2, you are increasing your viral load. Some of those particles are going to be trapped on the inside of the mask. Most of them will come out the sides and the plume of exhalation that comes out with every breath, escape into the environment. But some of it will be breathed back into your lungs. A mask causes self-inoculation. It causes you to rebreathe more of those viral particles that can re-enter your airways and go deep into the lungs and reinfect the lung cells. I'm in no uncertain terms, someone that gets infected with SARS-CoV-2, the worst thing that you can do is put on a mask and start rebreathing those viral particles. You will increase your viral load, and what would have otherwise been maybe an asymptomatic case, which most of them are, the overwhelming majority of cases are asymptomatic. But you put a mask on that mouth, and you start rebreathing those viral particles, and you're likely to turn a mild or asymptomatic case into a severe or lethal case of COVID-19.
And may I add, Dr. Meehan, another thing now, since the mask business is a big business, there are masks that are, they have prints on them, they have, I see people wearing all these colorful masks and all that. And actually the toxins now that they are inhaling, besides everything that you said, and the quality of the masks, who is there to actually regulate this? Is that okay? The inhalation of all these toxins?
No, you hit on such a great point, Maryam. These are completely, a lot of these masks that are being pumped out, they have logos, they have corporate logos, school logos on them. They are paints and dyes and coatings that are, some of them are more toxic than anything that should be entering our lungs. There was, in fact, the state of Tennessee, they bought like 5 million masks for their population. I think this was about May of this year. They were coated with this antimicrobial substance that is a registered carcinogen. The state of Tennessee had to recall all of those masks, the 5 million that they bought, and millions of dollars of taxpayers' funds that they wasted, because anybody that was wearing those masks was being poisoned by what they were breathing in as that microbial coating was going into the lungs. Many of these paints have multiple forms of toxins in them that have the potential to wreak havoc on our bodies, our physiology, our immune system. So, and nobody's regulating these. There are masks that are made of substances and fibers that nobody is thinking about. Well, are those fibers going to release? Are there little loose fibers that are going to be breathed into our lungs? Because we've already have cases where we have some of the polymer fibers that are being found in the lungs when we do a lavage or a washout of the lungs. This is, there's not enough regulation. We didn't have the FDA is not regulating these masks. We don't know what's going on the faces of our children and our population, and many of the things that are going on our faces are dangerous. They just add to the already long list of dangers that masks impose on our bodies, and nobody's watching out for that.
Here in every corner you go, there is a little kiosk with all these masks with different prints and paints and all that. But Dr. Meehan, the California governor, I don't know if I should laugh or cry, but he has suggested that when we go to the restaurant, in between the bites, we need to put the mask back on and then bring it down.
I saw that. That's,
I mean,
again, you're, oh, I'm sorry. Go ahead, Maryam. I didn't mean to
no,
interrupt.
it's just, I didn't know what to say.
Yeah. Well, what you have to say, what we all have to say is, you know, Governor Newsom, that makes absolutely no sense. In fact, it's going to increase the transmission of disease. The more you handle a mask, the more you touch that mask, the more you're going to transmit everything that mask contains or that your fingers have touched. You're going to put on that mask or take from that mask and spread into the environment. So, you know, this ridiculous, absolutely anti-science, anti-sense recommendation by Governor Newsom to tell people to, you know, take your mask off, take a bite, and put it back on. That is idiocy. And I don't know where it comes from, but it does not come from the science. And it's almost like it's almost like so many of these governors and these you know, these voices that are out there, they are making recommendations that are going to make things worse for our population.
And none of them have any medical background nor any medical knowledge, and I don't know where they are bringing that these suggestions from. Somebody like the California governor, I don't know, he had a secret deal, he bought from China, he bought all these masks, and of course they need to be used. So
right.
Maybe it's just their profit.
Well, I can tell you, I have a little bit of insight into where some of it's coming from. There is a kind of a central, there's a thing called the Bloomberg Project, and our mayor here in Tulsa, Oklahoma, is involved in it. The Bloomberg Project gives cities, you know, large amounts of money. I think Tulsa got $1 million, but to receive that money, they have to follow the guidelines that are being put out by the Bloomberg Project. And this is Anthony Fauci is somehow involved in it, and a number of these I mean, it has a kind of a leftist leanings. I believe, you know, we know who Bloomberg is, former mayor of New York City.
Yes.
We know where his political leanings are, but there is this central clearinghouse that is kind of sending money to states and telling them, here, follow these guidelines. And if you don't, you got to give us back the money. So they're, you know, follow the money and you'll find, you know, the answer to many questions. But I don't know where they're getting their science, but it's not the science that's in the medical literature.
It's, I don't know what to say. The quarantine
I wanted
phase.
to say one other thing, Maryam,
yes.
about the cloth masks. You know, there was a study out of Duke University that was they were doing a study where they used laser spectroscopy to visualize the viral particles that were emitted during talking, singing, coughing, sneezing, and it was meant to show that, you know, masks work, that they block that stream that comes out of the mouth when we talk, speak, sneeze, and cough. But one of the findings in that study was very interesting, which was that thin masks, cloth masks, gaiters, fleeces, you know, many of the commonly used masks that are being used by the public were not only not blocking viral particles appreciably at all, but they were actually increasing the number of aerosolized particles in the air. Now, here's what I think is happening there, and here's what that study showed. It showed that those, you know, bandanas, thin masks, or you know, 1 or 2 and 3 layer masks, anything less than about 12 layers of fabric were actually they were blocking the large respiratory droplets, to most of them, but they were increasing the amount of small aerosolizable particles. Now, these are small particles that almost no mask blocks. Surgical masks don't block them. They enter into the environment and they suspend in the air. They're so small that they can stay in the air for hours after someone has passed that has COVID-19 or influenza or most respiratory viruses. And so what appears to be happening is that these thin cloth masks are catching the large respiratory drops, but then those larger respiratory drops are being dehydrated. They're being, the force of our breath, the heat of our breath is shrinking down those large respiratory drops into smaller droplets, or what's called respiratory droplet nuclei. They're less than 5 microns in diameter. They suspend in the air and they hang there for hours. And it was, the cloth mask may actually be increasing the transmission of the virus because they're creating more infectious respiratory droplet nuclei that are aerosolized and just hang in the air, waiting for the next person to come by. And it would be better for you to not have a mask, to have those large droplets fall to the ground where they're going to essentially be neutralized, than it would be to wear these thin cloth masks, which are mainly what people are wearing out there. Very few people are wearing, surgical masks. Nobody's wearing an N95 mask in the public. There aren't enough of them. But that's what we, if we really wanted to make a difference, we would probably be doing N95 masks. But then you're going to really suffer the oxygen blocking and other detrimental effects of that, more restrictive mask type. So we're all of these recommendations are forcing the public to do things that are almost certainly increasing the transmission of the disease. And that, again, that's what the big data appears to be showing. They're showing that when you force mask mandates, there's an increase in hospitalizations and deaths.
Right. So the quarantines failed, quarantining normal, healthy people. They traumatized a lot of people by restricting the entry to the hospitals and visiting our sick or terminally ill patients. And I think it was a crime that a lot of people died alone.
Oh, yeah.
And a lot of children who were at the hospital, they could only have one parent visiting. They did not allow the second parent to come. And for the life of me, I cannot forgive that. That was a crime, what they did. My other question would be, Dr. Meehan, for you. What do we do about the flu vaccine? There are a lot of people now who are asking, should we get the flu vaccine? Would you?
Absolutely not. Yeah, again, this is a topic that I've studied extensively. I'll share that paper with you too. The flu vaccine, there's so many problems with it. Number one, again, in the high level scientific analysis, Cochrane Collaboration has done multiple meta-analysis of the flu vaccine, and they have said that it's essentially useless. It doesn't prevent hospitalizations. It does not shorten the course of the disease when you get it anyway. We've been missing the viral strains most years. They use some statistical manipulation to make us think the flu vaccine is more effective than what it really is. When they say it's 50% effective, for example, and 50% effective for the flu vaccine would be a stellar year for the flu vaccine, because it's usually much less than 20%. But when they say it's 50% effective, they are using relative risk ratios. That is, you have to understand that relative risk versus absolute risk is the difference between the flu vaccine may prevent about it may improve or protect against influenza infections by about 1.2%. But that's the absolute risk reduction. But when you look but what they will say is that we studied a group, and one group got the flu vaccine, one large group didn't get the flu vaccine. In the large group that got the vaccine for influenza, they had 2.4% infections. They had 2.4% fewer infections. They got a 2.4% protective effect. In the unvaccinated group, they got 3.6% protection. So they were less protected by 1.2%, right? 2.4 versus 3.6. What the vaccine industry will tell you is that's 50% effective. Their relative risk reduction was 50%, but it really was only 1.2% difference. That's the statistical manipulation of the numbers to make a number that is small and inconsequential look bigger when they use relative risk instead of absolute risk. So that's one problem with the flu vaccine. It's mostly ineffective. Number two is we have a number of studies now that have shown that people, and especially children, that get the flu vaccine become more susceptible to other respiratory viruses. As much as 440% more likely to become infected by any of the other 199 pathogens that cause flu-like illness. Influenza is just one of about 200 respiratory pathogens that cause flu-like illnesses. Now, if you get the flu vaccine, you are more susceptible to all the other respiratory pathogens. You're more likely to become infected by one of those respiratory pathogens. A similar study was done by the United States Department of Defense on military personnel. A lot of people have heard about this study because it's very telling. It suggested that healthy young military personnel, men and women, that got the flu vaccine were about 36% more likely to become infected by coronavirus. Now, the beta coronavirus family, the common coronaviruses that cause, colds and flu-like symptoms, and not SARS-CoV-2. This study was published, I believe it was in 2017. Right. But and metapneumoviruses, echoviruses, rhinoviruses. So all of these other 199 some odd pathogens, you become more likely to become infected by one of those other pathogens. Influenza is a small portion of all the flu-like illnesses that present to the hospital. In fact, they're about 15% of all cases. So a flu vaccine is probably increasing, based on the science, good high-level science, is probably increasing your susceptibility to other viruses, including coronaviruses. So I'm very concerned about the recommendations at this time to, get your flu vaccine, because we don't want you to get influenza and be at risk for coronaviruses. It may not be protecting you. It may be making you more susceptible. The other thing that has been shown in the science is when you get the flu vaccine and then you catch one of these other pathogens, these respiratory pathogens, when you become infected after being vaccinated with the flu vaccine, you exhale, cough, sneeze about 640% more viral pathogens than unvaccinated people that get the same pathogen. So you get the flu vaccine, you get infected with a strain of the flu that wasn't covered by the vaccine, or coronavirus, or one of these other respiratory pathogens, and you are a super spreader. Every breath is releasing 640% more of those virions, those viral particles that could infect your community. I think that we have been creating influenza epidemics in our states and in the world by the vaccine program that has been pushing influenza vaccines that the science says are worthless. But the other part of the science says it may be dangerous, maybe increasing your susceptibility and making you more infectious when you get infected by a disease that were made more susceptible to. So I think that's frightening. And I think it's, the last thing that you should do right now is get the flu vaccine. They're telling you, when you look at all of the things that we're being told right now, we're being told a lot of things that are going to make the disease and deaths worse. Where is that coming from? It's almost as if there are forces in our government, in our world, that want the population to be sick, to be scared, to be, hiding behind a mask, manipulated into, staying in your home, staying out of the sun, for goodness sake, where you could get vitamin D, which is one of the most important things to protect you. Does somebody want us to actually be getting sicker? And if so, the way to do it is to follow exactly what they're telling us to do.
Dr. Meehan, once again, You're great. Thank you so much for all the information. Unfortunately, we are out of time, but I want you to promise me again to come back.
Always.
I think I'm your #1 fan, and I want to thank your I want to thank your beautiful wife Kathy for making this happen every time, and I really appreciate all your information. Thank you so much.
Well, I want to thank you, Doctor. I want to thank you for getting this information out, because we are really we are in harm's way. What we're being told to do is putting our children, it's putting our wives, our husbands, our brothers, sisters in harm's way. And if we don't stop listening to this anti-science nonsense, we are going to be harmed, and people are going to die. So I thank you so much for getting this information out, for being brave and courageous in the face of all those that would harass, censor, suppress this kind of truth. And thank you for that. And I'm always glad to be here and participate side by side with you, just getting the truth out.
Thank you, my super doctor. Thank you so much. And thank you so much, everybody. You saw the great doctor talking about flu vaccine and masks. Until next time, smile and stay healthy.